the thing is most of us, when we come to something like this, right? Our goal is, we go, yeah, I want to be in a little better shape. But the reality is, you peel it back, most of you are here because you're saying, I just want to hurt less. Right? Is that true? So the reality is your primary pursuit, if you peel back the layers, is getting away from pain. And I'm going to tell you, that will never work for you. You're never going to get it. And this class is going to show you why you keep struggling with your pain problems and your fitness challenges. And it's not because you got a bad hip or a bad shoulder or a bad knee. That's not it. And there's so much science behind that statement that for you to actually study that, because you're going, no, I'm experiencing it. But what happened in this scene is you see that at one point when he really clobbers Neo, they're back in the ship, right? And you see Neo, it's all gray, and Neo's plugged in, and he does this, right? And the reason being is because you're experiencing a certain aspect of reality that's holding you trapped. And so at the final scene on this is when Neo goes, I know what you're trying to do to me. And Morpheus says, I'm trying to free your mind. And that's what I want to do today. So this is just a start point. This is some really deep stuff we're going to do today, and I'm just going to scratch the surface, but I hope I put it together in a way that the concepts will make enough sense to you that you can get through that terror barrier and take that next step towards your transformation. So you remember that what this whole series is called is One for Life. The one stands for your optimum neurologic expression. There's no doubt in scientific reality that you live your life entirely through your nerve system. Your entire experience, how you perceive, how you internalize, how you react to this reality is through your nerve system. And so to optimize the function of your nerve system needs to be your foundational goal and concept as you implement health goals into your life. And hopefully into your kids' lives and your friends' lives and what have you. We got to stop being situationally motivated and realize that oftentimes bad perceptions lead to bad outcomes. Right? We've all experienced that, right? Anybody married knows that. What did you mean by that? Just what I said. I mean, nothing more, nothing less. So we said, how are we going to achieve that optimum neurologic expression? And we started with your attitude. Your attitude. What's the old cliche? Your attitude determines your altitude. Right? Number 2, you are what you eat. And if you're a carnivore, you are what they ate. Number 3, what we're going to be looking at today is movement and how that pertains to having an optimum neurologic experience. And then what we covered last week was eliminating toxins. And last week was really a bummer class, you know? The toxin class to me is just a bummer class to teach. Because it's just so much like, all right, we're all going to die. Have a nice day. You know? I mean, it's really a lousy class because, and there's not a lot of like, go home and do this amazing thing and your life will be better. It's really like, just stop trying to kill yourself subtly. You know? I mean, that's really kind of the end of it. So how many people went home last week and you went, all right, I'm already starting to purge out some junk. You know, you're going, these cleaning products no longer need to be in my house. Or, yeah, we got some people in the back. Or you looked in your cupboard and you went, whoa, these foods are not foods. Just because some scientist made them taste like food doesn't mean they're food. How many people went back home and cleaned out their cupboard a little bit? A couple of people. By the way, who all's on the detox right now? How we doing? I woke up this morning, look at me, I'm feeling like supercharged. I felt so good yesterday, I actually didn't freak out sitting in front of lawyers in a deposition for 4.5 hours. I did go home and take a shower. Twice. I'd rather muck stalls than do that. I disagree. Mamas, let your babies grow up to be cowboys. Don't let them be attorneys, okay? Yeah. We're going to cover that today. Okay? That's good. Thank you. All right, so toxins. So we need to keep eliminating toxins. Next week we're going to do the nutrition. So the toxins and nutrition kind of play together. Actually, you should be seeing that all of this plays together. Because if you drink a bunch of booze, your movement's going to be impaired. Yes or yes? Yes. Right. All right. And your attitude as well. So the life part is living in full engagement. My sister calls this living with intention. Like if you're going to navigate this world effectively and actually hit any of the meaningful goals you have, there is no 80-20 rule. It's 100%. And here's the thing. Remember when you were a kid? Okay, I'll speak for myself. When I was a kid, I had alternate personas. You know what I mean? I had the persona that got me ice cream, and I had the persona that got my butt whooped. And I had the persona that schmoozed girls to love me, and I had the persona to cause girls to leave me. Anyone relate to this? And I wore multiple personas, and the thing was, the hard part of that is really hard to know, like, oh, which persona did I use on Jill, And it's actually harder. See, it's actually harder to live 80-20. It's actually harder to live 90-10 because it just takes so much work going back and forth. Just be. Live with full intention. Because if you just live with full intention all the time, you're just always you. You're always on your goals. You're always focused. You're always Christian. You're always that. It's so much easier because you don't have to check your back. You always know. The only thing that might be different is maybe you need better skills at articulating that or expressing that so that other people don't have misconceptions or misinterpretations. But you just always be you. And that's what I want you to be. So always be living your life in full engagement. Now, this plays a big deal in today's class. Remember this slide. Everyone remember the slide from the first class? I really love this class. I like teaching it because it always regrounds me. But the big part of this is that our optimum neurologic expression, that we live our lives through our nerve system. We tend to think of it from a standpoint of everything we see, hear, taste, touch, or smell. Right? So we're constantly getting information from our environment, and then our body reacts to that. Right? So if you love skydiving and the door opens on the plane and it drops 60 feet automatically because of the wind drag, you're like going, woo! We're getting ready to roll. If you've never been skydiving and you're up in that plane, the pucker factor sets in. Same experience, same reality, same environment, two entirely different reactions. Physiologically, we did blood draws on those two people. There would be entirely different brain chemistry, hormonal chemistry, everything else being produced in those two people, yeah? Yep. But the environment's exactly the same. So we tend to say, oh, it's my circumstances, it's my environment. And I need to tell you, rarely is that the case. At least for those of us who most of our problems are first world problems. Right? So the part that's missing from this is that we actually start creating our own environment, whether we're aware of it or not. And that is that we now know through the study of what's called epigenetics, is that your genes do not dictate your outcome. It's your perceptions and reactions to your environment that dictate your genes, that dictate your outcome. And that's really an amazing concept. Now, you don't get to pick, do I get blue eyes or green eyes or brown eyes? But you can predict whether or not you're going to be another person in line for breast cancer in your family. And that's pretty amazing. So from that, you're left with a couple of things. You're either saying, what is it, Sherwin Cartham used to say, right? You know, amen or oh my. Right? It's either like, awesome. You mean I still do? Okay, cool. I really do have some control over this thing. Now I just need to learn how to master that. Or you're going, wow, I just really suck. There's no hope for me because I really suck. Right? You're kind of left at one of those two extremes. I'm hoping the former, not the latter. So if we looked like our sensory nerves dictate, that's what we would look like, right? The famous homunculus, right? Some of the girls in the front row are going, okay, I've looked at it long enough. And clearly he's Jewish. So, all right.
You can see that?
So what we see here, taste, touch, and smell, we don't look like this. And the reason being is because it's missing a primary thing, and that is movement. The aspect of movement, like this slide says, balances life. And I don't mean like this false balance, like balance your work and your social life. You know what? There is no balance. You guys, just stop that. I don't know where that 70s pop psychology is still falling forward. There's no balance. You get it? There's no way you can balance it. You know, you're in the moment, and you're 100% in that moment, and you give 100% to the moment, and just there it is. There is no balance. There is no multitasking. You can only do one task at a time. Now, you might get better at switching from one task to another. You might get better at prioritizing your things. But the idea of balance is a myth, with the exception of movement. Movement, there's definitely balance, and it is, in fact, measurable. The problem is that biomechanics is extremely complex, like the internal workings of a watch. The movement of one gear affects all the other gears. So the movement of one part of your body affects your entire body. And that's the problem with our modern rehab systems and medical system. That was why it took me 4.5 hours of grilling from attorneys yesterday on people who had their biomechanics screwed up. Because people tend to think, all they think of is pain, no pain. Range of motion, no range of motion. That's it. They're so limited in their concept of how complex this system is, and that one thing affects all things. That's the reality. But kind of like Mitt Romney saying, I've got a 52-point plan to get us out of this economic mess, and everybody went, oh, that's just absurd. And it's like, I would have said, if I was Mitt, I would have said, look, idiots, if it was a 3-point plan, even Obama could have done it. I'm sorry, anyone could have done it. 3 points? Come on, 3? It's way more complex than that. I'll try not to be so political. Yeah, it's fun if you agree with me, right? So how do we navigate this world? Because this is important. I mean, the only stress that's applied to our body from conception to death is gravity. And so the good Lord, or billions of years of trial and error, have made us pretty adaptive to it. We live in the widest variety of environments of any other species on this planet. And we thrive in those environments. We don't just exist for temporarily. I mean, we can stay there. And that's pretty amazing. How do we do it? And a large part of it has to do with this concept of being able to navigate reality. So I use the example of these little smartphones. And I've got apps in here that do all kinds of groovy stuff. Some of them are like my fishing app when I'm sitting in airports for hours on end. And I can cast, I can do a short cast, I can do a long cast with it. I can cast that way, I can cast that way. when I'm reeling in, I can change the angle of my line so I don't snap it.
Everybody around you thinks you're nuts.
I really, look, they're right. I mean, I'm kind of like okay with that. So, but it's pretty amazing, right? That this thing can do that. Although I was driving in San Francisco last week and it said, turn left here. I went, Siri, it's a one-way street. You going to pay my ticket? Some of you use Siri, you know what I'm talking about. All right, so your body does this too, and it does it through a series of different types of accelerometers in your body, much like the accelerometers in your smartphone. The first one is the one that most of us understand, the inner ear, right? Anyone here ever have vertigo? Okay? Anyone here ever have vertigo, go to their drug dealer, a medical doctor, and the medicine doctor says, what you have is benign positional vertigo, or something along those lines. There we go. And they usually tell you this thing like, there's these little stones on the head, there's little crystals.
Oh, yeah.
And they fall off for some reason. You guys, we say that so much. If you Google it, that's all that comes up. There's no scientific evidence that that occurs. And why all of a sudden, in the 21st century, are everybody losing their marbles? Right? But nonetheless, the way this system works, if you'll imagine with me, is you got a loop filled with fluid, and then you got a loop filled with fluid, right? And then you got a loop this way filled with fluid, called the bony labyrinth. And in it, this fluid is in here, and we've got these little hairs. And as you move, just like if you move water in a jug, the water sloshes back and forth. And so what that does is it moves the hairs a certain way, and they're all moving at once, just different angles. And your brain gets this data and processes it, much like my iPhone does, to know that I'm going to catch that smallmouth bass over there. And it says, all right, I'm moving this way. But once you're moving at a constant speed, it no longer perceives the movement. Right? So we feel it when we take off in the roller coaster. We feel it when we're landing in the plane. But once we're cruising, it doesn't matter if it's 1,000 miles an hour. You don't feel anywhere. You walk around like nothing's going on. So please understand that the inner ear can only detect changes in movement. It can't detect position. It doesn't know how you are within the field. It just knows whether you're moving in the field or not. Cool? Pretty amazing. The other one is the eyes, right? Anyone here get motion sick watching 3D movies? A lot of people do. Okay? And it's because the eyes, all this visual data is coming in the brain, and the brain's been trained for however many years you've been alive to go, whoa, that means we're moving. Or that means that thing's coming at me, right? So the eyes are getting this data in. But now the brain's going, inner ear, what do you say? Huh? What? I'm not hearing anything. What's wrong with the inner ear? They actually, when they originally built the San Mateo Bridge, the poles were spaced exactly the same distance apart. And what happened was when you're cruising at a constant speed, it was like a strobe light. And what it did was it hypnotized people. And they started like, right? So they literally had to put variations in it so that that wouldn't happen. Cool, right? And it's because how profoundly the eyes can do this. So in a sense, the eyes give us information of a blend of both movement and static position. So the eyes can tell if I'm standing still, the inner ear is not getting data, and things are moving around me, that it's things moving around me, not me moving through things. Now I could get really complex and go into Einstein's theory of relativity right now, and we could talk about whether or not the opening of Genesis actually meets science or not. But I won't do that today. It's actually a really cool lecture, but not today. All right. So how do we do this, right? How do they do that? How do they do this backflip off their hands, spring, land, and jump, flip, and land on their feet? How do they do that? It can't all be processing through the inner ear because during that momentum, the slosh is consistent. It can't be their eyes, that's for sure. Because all they're seeing in that moment, if you look at her head position in this, is just a blur of data. So how do they do this? Where is this information coming from? How does a giraffe stretch and eat here and then bend down and get a drink of water without the blood pressure literally blowing their skull right off their head? How does it do that? And the answer is proprioception. The answer is proprioception. You're constantly reading the gravitational forces on your body so that your internal organs can adapt to the stressors of living on this planet. And that's going on constantly. And it's doing it through the inner ear, or the inner ear, the eyes, muscles, joints, tendons, etc. So if we look at this, the eyes only constitute 10% of the data. So here's the dilemma. Do you see what you believe, or do you believe what you see? You're only getting 10% of your operational data from your eyes. Now, I don't know about you. I'm not betting on 10%. Inner ear is only 20%. And yet, whenever anybody has balance problems, motion problems, movement problems, the drug dealers and the knife sharpeners only look at the inner ear. That's all they think of. Inner ear. It's all inner ear. Oh, it's inner ear. It's inner ear. It's always inner ear. Here, some drugs. They'll shut that inner ear up. Now, I'm not saying in the moment that might not be an appropriate thing to do. Vertigo is nasty. I've seen people, some people just get kind of that, ooh, like, and other people are like, like total seasickness. They're barfing the whole bit. So I recognize that that is not a laughing matter. And to tell the truth, I'm going to say it's definitely not a laughing matter as you understand the rest of this lecture, because disruptions to your proprioception profoundly affect your interpretation of the environment, which then dictates your physiologic functions, which then dictates your output, which then dictates your environment, which then feeds back in. And if it's screwed up, it's only going to get worse. And when I say what is the it, you name it. Your attitude, your relationships, your cognition, your clarity, your kidneys, your liver, right? And if you go forward with that and you start looking at how that affects your genetics through the field of epigenetics, you start going, my kids, my grandkids, my great-grandkids. And you start realizing the value and why we're in such a conundrum, because this, I don't know, I didn't see it anywhere on the Kaiser site. I didn't see it anywhere on the Sutter site. Okay? I don't ever hear this taught in high school biology, right? But they'll tell you that you need to get your horse pus and cow piss directly injected in you multiple times a year. Yep. So is proprioception an advanced form of touch? Maybe. So maybe it's not a sixth sense. In your joints, you have different types of nerve receptors that feel pressure, that feel movement, etc., tension and movement. And this is why, if there's disruption in a joint complex, that if you have changes in the barometer, right, it's going from cold to hot, it's going from rainy to dry, people come in and they go, I can feel it. And we used to think that was an old wives' tale, but that was before we saw the Pacinian corpuscles. And we went, oh, you're measuring pressure changes. You're just more keyed to it than other people. That's going to be important for you to understand as we go through this and apply this to how do you get your body back under control so it's not hurting so much. Okay? Believe it or not, these can all be trained in and trained out. They also come not just from the joints, but it also comes from the muscles and particular the tendons themselves. So the tendons, right, they can feel the stretch. And so it tells you, as my arm, part of the information that my brain is getting that my arm is bent right now is coming from the slack of this tendon, the tension in this tendon, and the differentiation of pressure inside my joint. Right? Because in this position, there's more pressure on the inside of the curve than the outside, right? And so the brain's getting all this data and assessing it to where I can go, there's my ear, there's my nose, there's my eye, there's my chin, there's my other shoulder, there's my knee, and I don't miss. I mean, you think about the amazingness of that. Justin Bieber? Totally distorted posture. Is this strong evidence that severe forward head translation leads to tension in the spinal cord, which distorts reality? I'll let you be the judge. But the reality is, we know scientifically that spinal configuration profoundly affects organ function. Okay? And when people keep coming in, I mean, God bless you, but you keep laying on the table and you got to stop me and point at everything. Knock it off. Okay? Because all you're doing is training yourself that pain, 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 pain. All you're doing is training that into you. I mean, you can tell me, it doesn't hurt me at all. I'm just saying, you're training your body constantly. I'm in pain, it's here, my pain, 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 pain. And what you should be going, hey doc, check my spinal configuration. It needs to be clear, or as clear as we can get it today. Right? Even if we didn't have the balding head, and I told you, who's older, this guy or this guy? We all know. We all know. Right? With rare matter of fact, you see a young person all like this, your brain goes, whoa! That ain't right. There must be something profoundly wrong with them, yeah? But we see old people like this all the time and we just think, hey, how you doing, Bob? Pretty good. Right? Why? Why do we ever accept this? It shouldn't. Look, there's 3 studies that I pulled right here. I could have pulled 3,000 studies on it. But these 3 kick off. The first one was done at Harvard, and they found that people, if we just had people sit in this position, and they did psychological profiling tests on them, people that sat in this position versus people sat in this position, people in this position tested significantly higher on optimism scales than people that sat like this. And they just randomized them. They took people that had great posture and forced them into this, and they took people with crappy posture and put them into this. I mean, they just randomized it. So just your posture plays a role in how you view the world. I wonder what this is going to do to the next generation.
No kidding.
Yeah.
There was another study that showed this position, like Justin Bieber, can shut off as much as 30% of the oxygen flow to your brain. How's that going to work? Any of you had a CPAP? You notice like how profoundly different you felt when they first gave you. You're like, oh my God, I got my life back. But how much of that is because we're sleeping on pillows? Right? This is so profound that they studied seniors, and they found that this progressive kyphosis dramatically reduces their function, their ability to do extracurricular activities and what have you. And so it profoundly affects their morbidity outcomes. And that plays a direct role in their mortality numbers. This is extremely important for us to understand, because we have the ability now to keep people living a long time.
So ditch the pillows?
Yeah, ditch the pillows. Ditch the pillows. But with that said, because already a lot of you should be like, John, your brain's already rolling. Oh my gosh, I need to do this, I need to stop doing that. Already your brain's rolling, if you're right. And already you're going, I already know 5 people that need to come in and get a complete spinal neurologic evaluation from somebody who knows what the heck they're doing. That I'm not going to keep having the school nurse go, yeah, your kid's perfectly healthy, go at it. That we're going to actually do real spinal diagnostics, real neurologic evaluations. You should already be thinking that. Oh, well, my insurance doesn't cover it. Well, ask yourself, will they cover the prolonged hospital stay? Maybe your insurance will kick in and buy a little nicer casket. I mean, we've got to stop this. Whether the outside world understands reality or not is irrelevant, because the people in the matrix are crazy. It's crazy town out there. When we're drugging up all our kids for ADD, ADHD, OCD, obesity, diabetes, showing up in younger and younger, it's crazy town out there. Status quo is a no-go. So how easy is this? Well, here's the uppermost layer of muscles that move your body around. Okay, so what I want everyone to do, this is the longissimus muscle right here. I want everybody to just flex just the longissimus muscle on the right. Ready, go. For those of you who are successful at that, I'm going to up the challenge. I'm going to have you just flex the erector spinae muscle between T7 and T8. Ready, go. And yet everybody, it's like this. Misguided gentleman yesterday who had a law degree. And he's looking at it, he's going, well, you've seen these patients 500 times over the last 4 years. And I go, yeah, which was not true. But it's like, yeah, whatever you say. I just don't understand that. It's like, it seems odd to me that somebody can have a soft tissue injury, fibrosis of the lungs, and they take a medication and then lay on a CPAP machine every single day of their life until they die. And we don't call that overtreatment. See, this is the reality, right? So I don't get it. I mean, I love y'all, but even the best of you, it's like, hey, can I reduce my visit frequency? Yeah, just depends on how much death you want to absorb in your life. I mean, I hate to say it, it's this reality. You got to balance it out. You got to figure. Look, if you can't move the individual segments on your own, how do you even know if they're moving right? So the only way to know if the individual motion segments are even moving right would be what? You're going to have somebody go, that one's moving right, that one's moving right, that one not so good, that one, we'll come back to that, right? And you want to do that on a somewhat frequent basis. And we go, once a month chiropractic's always worked for me. I'm going to say, no it ain't. So these are the dilemmas, because we haven't made the transition into culture. There's going to come a day down the road, we're going to understand this so well, everyone's going to get it. It's like, this is advanced neuroscience, just so you guys know. Anybody not tracking with me? I mean, it's not that complex. I mean, I could add a bunch of fancy words to it. Rubrospinal thalamic tract and all that fancy stuff. Substantia niagara getting improper nociceptive bombardment from the sensory afferents. And that's what they want when you're a witness, right?
Yeah.
Ooh. Look, it's not that complex, but if you ignore it, it will become complex. In order to move, this is a great book called Anatomy Trains. In order to move, think about the amount of muscles that have to work in synergy with one another. And I use the example at one of my classes of this. I take Jill's water jug here because she's like on it, making sure she's getting half her weight in ounces a day of fresh, clean water. And if I hold it here, it's no big deal. I mean, it's almost imperceptible. But if I hold it out here, it's a whole nother gig, isn't it? Even the strongest person in here, there's going to come a point, probably in under 5 minutes, that you're going to have to do this. Now, as I hold it here, I don't just feel it in the obvious muscles, my deltoid, my bicep, maybe a little bit of flex, a little bit in the carpal muscles here, right? But I also feel it in my low back, because it's wanting to do this to me. If you had EMGs hooked up, you'd see that my calves are firing different. My hamstrings are firing different. That actually, this arm over here isn't totally relaxed. There's an increase, I can even kind of slightly feel that cognitively, that there's a slight increase in the contractile force in the opposite arm that isn't even doing anything. And that happens without us thinking about it. Or it should. So if you understand this complexity of how the nervous system has to guide all these things, how that affects your internal organ function, and how that can even affect your genetic expression, I mean, where should we be paying most of our attention in health? Health, not disease maintenance, not pain relief. Health, optimum neurologic expression. The other one that I'm going to touch on, and we'll show some examples today, is rotator cuff. How many people here have problems with their shoulders? I mean like shoulder, not like generic shoulder, but shoulders. It's amazing to me how many people come in and they're in their 40s to 50s and they got rotator cuff problems. And my thing is like, whoa, are you a professional baseball pitcher? Have you, you throw javelin on the weekends? I mean, how do you jack up your rotator cuff when the most activity you really get is, washing your hair? And the answer to that is because you're not getting the right amount of activity. It's not that you're overdoing something necessarily, it's that you're not doing something. And so the tissues get abnormal loads, and over time the body says use it or lose it. It gets weaker and weaker and weaker. The tendons get weaker and weaker until finally, the one day that you do something, and it doesn't have to be a big deal, just picking up a gallon of milk or something, bam, you blow out. So you can wait until that day, or you can start working on it now. Now, if you already got problems, you already got problems. To some degree, you're never going to get back to where you should have been had you been dealing with it all along. You won't. You're going to have limits. There are limitations to matter. But you can do all kinds of things to make this better. The main reason why I bring it up in this context is check this out. If I hold my shoulders forward, it's very difficult for me to pull my head back. That actually hurts. Everybody try that. Just comfortably roll your shoulders forward. Now try to push your head back. Not tip back, push. This way. It hurts. Now watch this. Roll, make a big circle, and when you get all the way back, keep your shoulders there. Does your head feel forward or neutral? Forward, but I didn't move my spine at all, did I? Now watch this. Now move your head back. Look how much farther I can get my head back. So look at how much just the balance of your muscles in your shoulder girdle play a role in your head position. Your head position being forward causes the discs to wear out, causes the cells to die, causes the matrix to collapse, causes bone spurs to form, causes stenosis or narrowing of the canal, causes frank neurologic problems. The frank neurologic problems now can't get the right trophic substances to the connective tissue, like a diabetic. And you start getting spontaneous tears and ruptures of muscles and tendons and ligaments and joint capsules. And we call this normal aging. No, only in stupid people. And we're all stupid people, amen?
Amen.
All right? Okay, fair enough. Me too. It's all a learning process. This whole thing is a big learning process. But let's not blame God. Let's not blame Obama or Bush or anyone else. It's us. And most people spend more time researching their next flat screen TV than they do how to take care of their skin suit. With the exception of this room, because you're here every week giving me your Saturday mornings. But then we got to pay in our insurance premiums and our taxes for those people that are sitting home right now, sucking down Doritos and Pop-Tarts and sodas, right? Oh, but it's diet. All right, so stages of transformation look like this. Unconscious incompetence. We don't know that we suck. Conscious incompetence. I'm fully aware that I suck, like me at basketball. Conscious competence. However, if I practiced often, I might become better at it. And then we get to a point where it's this unconscious competence. You know, the most amazing one that I see on unconscious competence was years ago. It was a Wimbledon final. Pete Sampras and who was the crazy-haired guy? Agassi, right? They hit, it was something like 13 or 14 volleys across the net, and they were never farther than 10 feet apart. They estimate the ball was traveling in excess of 70 miles an hour. How can you react going, ooh, it's going this way, wait, it's going that way, oh, it's going here? Not consciously. It's whoa, 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 whoa. It was amazing. Google it. Yeah, it's the Matrix. It is. It's that level of unconscious competence. You guys, most of you are at a point, what brought you into my office originally, unfortunately, was not, hey, I want to have optimum neurologic expression so I can fulfill my destiny the way God created me to be. Most of you came in going, I suck, and I know I suck. Right? You came in here. And then through the process of doing exams, we found out all the areas that you unconsciously suck. What do you mean I got stage 3 degeneration in my lower cervical spine? I've never injured my neck before in my life. I don't have any problems with my neck. I'm like, yeah, you do. You know, you just don't have any pain in your neck. But this might explain why your thyroid's on the blink and why you get colds and flus all the time. Oh. So then we start working on you. And now we start freeing up the matrix a little bit. And you start becoming conscious of those areas that you got, man, I just don't know what to do with that. Now, some people jump off the boat at this point. You right? You ever meet these people that are like, you know, I quit smoking in the first 3 weeks. I felt like crap, so I just said, screw it, went back to smoking. Anyone know these people? I mean, fill in the blank. I mean, we could pick on smokers because they're easy to pick on nowadays, but I could say, you know, Dorito eaters, French fry suckers, soda addicts. You know what I mean? I mean, whatever, fill in the blank. But you start becoming conscious of your incompetence, and oftentimes that's that terror barrier, and we turn around and just go right back. I mean, I know I suck, but at least I kind of know how to play my slice. Right? And then the kids grow up, they move away, and the wife leaves you. Because you just said, I'm going to stay right here. And they go, but I'm moving on. See ya. If you want to catch up, good luck, because I'm walking. But where we want to get everybody is in this level of unconscious competence. So you got to start doing some things different. You actually have to start doing. The paralysis of analysis is one of the bigger problems I see in getting through this. We have the some days. Well, when things calm down, it's a really hectic time in my life. Guess what? If you don't fix this, it's going to get a lot more hectic. Fix this. Well, you don't understand. My kids got soccer. Take them out. Okay, maybe not soccer. Maybe not soccer. You get it. All right. Now, here's the thing. We can either do it the smart way, or we can do it the hard way. Who wants to do it the hard way? Show of hands. Ashley. Ashley's like, I love it. I love the hard way. All right. Awesome. Okay. Most of your pain problems and your anybody here say, I've never been flexible? Okay, so here's the thing. Most of this is a fascial perception. If I put you under general anesthetic, guess what I can do to you? I can bend you all kinds of ways. Now, the only real limitation for most of us is not our muscle length. It's the fascial adhesions. Fascia, this is that webbing. You know, like when you carve a chicken, and if you've ever skinned the drumstick, there's that thin, fuzzy kind of thing that holds the whole thing together. That's fascia. And we can get adhesions in the fascia. So as you start to stretch and that fascia starts getting pulled, your brain's getting data that says, whoa, stop, you're going to tear something. And so we don't. So it's not a reality that your muscles are shortened. It's your brain telling you can't do that. But you can do it. If I put you under general anesthesia, you wouldn't have that, oh, I got frozen shoulder. We would put you under general anesthesia and we could take your arm and do all kinds of stuff with it. The only difference would be those fascial adhesions. And they actually do this, what they call manipulation under anesthesia. They knock people out and they go rip, 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 and rip up all that fascial junk. And it's not as bad as you think. It sounds horrible, but it really isn't. They wake up, they get some soreness, but they go, oh my gracious. In a sense, that's what adjustments do. Is they take care of, in a mechanical sense, they take care of that, which then alters the neurologic input into the brain, which then over time retrains your body into that you can do things that you didn't think were possible. But if you did that, and then you just went, hey, you woke up, good, how you feel? Yeah, you got better range of motion, hey, cool, bye. And you went right back to all of your old habits that caused the problem in the first place, it's not going to take very long before the problem totally returns, yes?
Yes.
So the problem that we have is we don't rehab enough. Really, it should be multiple times, 7 days a week. That's the reality of it. So the more that you can work with for lack of a better term, a therapist, chiropractor, whatever, that can work you through these things. I just only know of chiropractors are the only ones I know of that deal with the segmental movement of individual vertebrae. You can use all kinds of other therapists for the bigger groups. But we're the only ones that do the segmental stuff. So you're going to have to do that often enough to retrain not just the tissue, but more importantly, the neurology. Right? Remember in the mind map class, we come in with a new ideation of reality, the Y program, and we layer that over our 30-year-old X program. At first, our results are going to be mixed. A bit more Y or a bit less Y, a little more X. But if we stay with it, regardless of what our results are telling our conscious mind, we stay with the plan, pretty soon we get more Y than X. And if you can stay with it and you don't alter, it's not like you don't drive like on I-5 up to Ashland, Oregon, and you get halfway there and slow down to 35. Hey, I'm halfway there. Let's cut the speed in half. And then you get halfway close, you get about Reading and you go, hey, let's just cut it down to 15. I mean, we're almost there. I'm doing better. I'm getting closer. No, me, I'm like a barn sour horse. The closer I get to home, the more I'm looking for radar. You know? All right, you get it. Here we go. Massage terrorist or a massage therapist? I have mixed emotions about Christy sometimes. But getting a good massage therapist, and you can tell a good massage therapist because they're intuitive. They're intuitive. You can tell a good chiropractor, they're intuitive. I get people all the time, they're the analytical. What are you feeling right now? What is that? What are you? It's like, don't let me don't take me out of the zone. I don't know, it's magic, man. I'm getting messages from God. I don't know. Just let me stay in the zone, Don't make me get all mechanical, right? And a good massage therapist is like that too. And if you've had one, you know what I mean. They can perceive, there's these subtle perceptions they read from your body that they know when to back off a bit. And they know when to go a little deeper, they know. But if you just get in there, you get a lot of these new kids on the block, they come in and they're just like bricks, man. And your body goes, what the? And your conscious mind is going, it must be good for me because it really freaking hurts. Oh, I did it. I'm sorry. Oh, okay. So you're tracking here, right? So what we want to do is we do need to get into those zones that make us a little uncomfortable because some of that is our neurologic terror barrier. But we don't want to go so far that we're traumatizing the body. Psychologically, not just physiologically. Because if it's absolutely miserable, but you're just muscling through it, you're still going to constantly stay in a state of guarding. And you're not going to get forward. And same with adjustments. Right? Same with adjustments. That's why some days I'm getting a reading from you and I move on and you go, whoa, dude, aren't you going to do that side thingy? And sometimes I read that as innate saying, all right, they kind of need it. And other times I'm going, look, I ain't your crack dealer. Okay? No, I'm going to do what your body said you need today. So what we have, and we have some up top, one of the best ways to start doing this in a more gentle fashion is what's called proprioceptive neuromuscular facilitation. What does that mean? Well, we know what proprioception means now, right? You put the words neuro and muscular together. It's the feedback loops of the muscles, right? And we're going to facilitate that, meaning we're going to speed it up. We're going to expedite it. So instead of just stretching like this, if I can contract my abs as I stretch, I can get a better stretch, right? Even though I'm not pulling myself with my abs, just contracting these muscles will give me a bit better stretch. If I, at the same time, contract my quads as I'm doing this, I can get an even better stretch of the hamstrings. And it has to do with how the feedback loops work, right? You can't flex your bicep and your tricep at the same time. You would be like this. It wouldn't go anywhere. So knowing that, the stretch towel program works you through a variety of movements. Now, one of the cool ones, do we have one open? This is a cool one. So I'll show you this in a moment. So the thing that's with this stretch towel program, and it's cheap, and it comes with a DVD, and it's a real no-brainer. You can pop the DVD in. What I recommend everybody do is just start with the 30-day program. The 30-day program each day will give you something that's about 4 minutes to 8 minutes. They're not real long, totally predictable, and they'll walk you through different exercises. Now, it's called a stretch towel, not because you're going to use it and stretch with it. It's because it stretches. So if I want to get my arms all the way behind me, that's kind of hard. Even if I stretch it out, that's kind of hard to do. But watch this. If I take it and I stretch, and I go back as far as I can, and I hold, and then I relax, and I stretch, and I go back. Now watch. Check that out. And then I relax, and I stretch, and I go back now. Right? So what changed? The neurology. The neurology. So, if you're smart, you will leave with one of these today and you'll pop the DVD in, and you'll follow it. If you'd rather, you can come in here, and on your visits, Ashley or Tiffany or I can walk you through it, and we'll charge you $50. It's up to you. Or you can just stay the same and go, hey, 80% of the time I'm thinking about doing better.
Good job.
Fair enough. Fair enough. All right. The Dyna disc. How many of you have the little Dyna disc already? And you're using it for the wobble stuff, which is great because you play with it and you start going, whoa, you start feeling it. It's like, oh, I'm stuck there. And you can start using that to become more aware, more conscious of your incompetence. And then you can work through it and become consciously competent. Yeah?
Yep.
So the other thing, what a lot of people don't realize, you can do all kinds of groovy stuff with that thing. So just any of your basic exercises, put the Dyna disc into the mix. Now, one of the best things for us to do as we get older is we're losing this proprioception. And some of that is because we've neglected these tissues for a long time. We've got a lot of fascial adhesions, we've got capsular adhesions, we've got all these different things in here that it's just neglect, right? But you can get it back. I mean, a lot of it you can get back no matter what age you are. So what we can do is we can start just in the evening just standing on it. You know, balance yourself, maybe the couch or something, but just stand on it and just practice trying to balance on it. And once you get good at that, you might even try some very shallow knee bends as you're on it. Very shallow, right? Right? We're not going to use the boxing glove, we're going to use our brain, right? And then you can just progressively do this. And if you just did this, you know, pick when you're watching a show and just say, whenever a commercial break comes on, I'll just stand up next to the couch and do this during commercial break. It doesn't need to interrupt your social life. It doesn't need to interrupt you at all. But studies have shown that you can dramatically improve your proprioception and your balance in 6 weeks just doing that.
How do you determine the appropriate amount of air within the disc itself?
For whatever reason, a lot of the ones we have here are overinflated. It actually should, when it's sitting there, look flat. Okay? So it shouldn't be a big blob. It shouldn't be a semi-ball. It's not meant to be a ball. It should be fairly flat. Shouldn't cave in though. Okay? It shouldn't be so soft that it just balances out, flattens. So just kind of visually should be just flat. And what you'll find is even the modest amount of pressure will cause it to cave in. Okay? Now, if you get really advanced, some of you are doing sports things and what have you. You're challenging your body. You're getting ready to do the Boston. You're training for these things. You want to make sure you're not going to blow a knee or an ankle. So you can start doing like one-legged ones of that and doing this. Now, if you can get to where you're doing it with holding nothing, now you're rocking. The odds of you blowing out an ankle or a knee or a hip in the Boston will be next to nothing. I mean, you'll have to step in a hole or have somebody knock you over. It won't be because your proprioception was off as you got tired and you caught a toe. Make sense? So training that proprioception is a big deal. And there's all kinds of groovy stuff you can do with it. You want to add it into your ab workout, balancing on that thing, it will rock your obliques. Okay? Foam rollers, another cheap tool. These are cheap. All of these things are under $30. You know what I mean? I mean, they're cheap. So foam rollers, you can use them for all kinds of groovy stuff. You can use it for doing your exercises because it forces you to balance. You can run it vertically along your spine and do exercises on anything, just basic stuff, just butterflies, things like that. In order to balance, you're going to have to use other muscles, right? So it's just adding a wide variety of those small proprioceptive muscles into the mix. You can run it horizontally and put it at varying levels of your spine and work on different aspects of your trunk muscles. by just shifting it up and down. You can use it just as a roller and just stretch over that thing. I've got Jim, we got that thing going. Jim is rocking it, man. Jim came in and he was just a crusty old dude, man. He was like this. And now he comes in and he goes, man, I love Jim, man. Jim should do the lecture I gave on SMART goals. This guy's got, his life is like, it's lined out. He's got multiple pins, and I always went, you know, nerd, and he's like, no, different pin for each thing. This means this means that. I mean, he's got it down. So now he came in and I had him lean against the wall and he's like this. Now I come in to adjust him and he's doing this. And it's because he works at it. And some days he goes, it's hurting. And I go, Jim, back off a little bit. You know, we don't need to get to the finish line tomorrow. You know, just back off a notch, but stay consistent. You can roll out your IT bands. Anyone ever rolled out like an IT band or a hamstring or anything on a foam roller? Woo, is it fun? But it gets the job done, and you bought the roller, or you can go pay a massage therapist $60 an hour to strip your IT band, or you can do it yourself, you know, just roll it out. So the ones we get here, I can order the really fancy ones, you know, they're harder. The ones we get here are fairly soft. I start with the soft density ones, because as you use them more and more, they get softer, and the odds are it's going to be easier for you to use. I don't keep a ton in stock, and I know that we're down to like 2, you know, but we can order them. So if you're interested in that, we can order them. You can get the short ones over at like Big 5 or Sports Authority, but we like to order the big long ones so you can do all kinds of stuff with them. So you get the long one and then you cut off like 16 inches of it so that you got one you can use as a roller, and you got the other one to do the rest of it to do your exercises on. It's just a cost savings.
IT band is
the iliotibial band right here. It's this fascia right here, and we can get that problem in here, and it can hurt because there's a nerve that runs right under that. So you want to keep that stretched out and that fascia separated. Anyway, I don't want to belabor that, just to show you that there's cheap, inexpensive tools that allow you to add proprioception into your exercises and your stretches, and will help you facilitate change, help you move forward better, help you hold your adjustments longer. Okay? Just stretching on them is great. Now this is a fun one. It's funny to me when I have people come in and they go, I just can't lay on that adjusting table very long. I'm going, holy crap, how do you sleep? Do they like prop you up in the closet? I mean, you lay down. Lay down. Oh, I just can't lay that long. Why? I mean, you were there 5 minutes. How do you lay in bed? It's just odd to me. And a lot of it is because what you've done at home is you lay in bed and you got all these pillows propping you every which way, and you're like, oh, good, I'm comfortable. Right? Yeah. So you can just lay on these rollers. This is exactly what I got Jimmy. You can see Jim's doing his exercise right now. You can lay on these rollers. You start with just getting your head flat on it, but pretty soon you can slide it down and let your head go all the way to the floor. Then what you do is you start bringing your arms up, and you stretch here, and you just stretch those pecs out a little bit. And then you come into here and you start stretching the subscapularis and what have you, and you start really dealing with those rotator cuffs. But you should be able to lay on your back and lay like this, totally comfortable. This should be totally comfortable to you. And if you're doing like this, we got to get some work done. Okay? And you can't do, oh, it hurts. I know. I get it. But that's all in your mind. Because if I knocked you out, your arms would go flat. Okay?
Can we do them against the wall instead of the...
Of course. Of course. So like for you, because right now we're transitioning, being able to get you up and down off the floor, of course. Most of this stuff, and that's really insightful that you said that, because you can see this is easy enough to adapt to the wall. So do you mind if I use you, Tim? We played with this the other day in the room. Tim, I'm going to have you stand with your back against this wall. So what I want you to do is just stand heels back, good. And I want you to step out 1 foot length. Okay, just like that. Now lean against the wall. Okay. Now what I want you to do is totally flatten your back to the wall. That includes your head. Okay, no problem. So now watch. So here's what I'm going to do. Now right now, I can fit my hand behind his back. And what I want you to do is flatten your back so I can't get my hand again there. So that's much better. I can still get my hand there. Try a little harder. Okay, now what muscles is he moving, right? You can see it already. Look at that. Look at that. Okay, relax, good job. Doesn't he look sexier when he does that too, ladies? I mean, that was like, you know, He-Man, you know? I mean, all of a sudden he was like, chest is up here, you know, awesome. So what that is you can see, it is his first effort got him so far, but it went, kick it another notch, guess what he had? He had another notch. Okay, so don't just wing it. Go for it. Okay, so yes, you can do that same thing right here.
Well,
Absolutely.
That's what I've been doing, but I
Good.
was questioning.
Yep, absolutely. Absolutely you can. Especially as you're doing this, because you could feel as you're doing that, all of this gets involved, right? So easy. No, there's no way you're going to traumatize yourself doing that. The problem with these circuit training machines, you guys join these fancy gyms, and go, oh, I just go do the circuit. The problem with that is, it's great for rehab. What it's really great for is rehab, and that's what these machines were designed for. They're designed to isolate one joint in a very basic movement, right? They're designed to do one thing. That's it. And the whole rest of your body is not being activated at all. They've specifically designed the angles and the cams and everything so that you're just doing one muscle movement. The good part of that is if you want to be a bodybuilder. Great for body sculpting. You're isolating muscle groups. So you're limiting the amount of physiologic energy that you're expending. And you can develop muscles. Most of us in this room, that is not our goal. Our new superstar, Tiffany, she was a fitness model. And now it's like, okay, that was enjoyable, but I'm moving forward with this. But so for her, that might have been perfect, because in those aesthetic competitions, it matters. But for most of us that are getting a little grayer in hair, what happens is we don't necessarily want all that. We just want to be robust. We just want to know that we can go on a hike and make it back. We just want to know that I can actually get my carry-on in the overhead. And I don't have to start going, Sonny, can you get my bag for me? Right? So this is good for that, but what it sucks at is you lose proprioception. And if all you do is do this kind of exercise, the problem with that is you will increasingly mess up your brain's ability to adapt. So you can see these people that got great big and they're, oh, he's in shape, works out all the time, and he's all buffed and ripped out, but they come in here hurt. And the reason why they come in here hurt is because their proprioception isn't working. So when that one time when it's not this perfectly controlled environment, that they step a certain way and they slip and they got to grab the rail, I tore my shoulder out. Even though they're all buff. And it's because their proprioceptors weren't trained to fire like Neo in the Matrix. They weren't trained to just fire, boom, boom, and protect. There was a slight enough lag, and in that lag, something tore. So that's the problem with this. This is the same thing for people that just go, well, I exercise, what do? I walk. That's pretty limited proprioceptive input. That's pretty limited. Now you throw some weights in there and start doing this, that's better. That's much better, because now different muscles are going to have to fire as I'm doing it. One of the things we're going to start doing, and I was going to wait till spring, but it's so gorgeous we might start doing it now, is Nordic poling. Anyone see these goofy people walking around with their Nordic poles? The thing with the Nordic poles, they've shown that you dramatically can increase your cardiovascular benefit. I mean, it's like 25 to 30% better than just walking, even speed walking alone. And the reason being is you're pulling, you're pushing like this as you're doing it. The other thing it does is it forces you in an upright posture. So you're engaging your core and your postural muscles as you're doing it, instead of like, how much farther, Mabel? Right? So that's a good one, and you can get poles as cheap. I've seen them as cheap as like $25 over at Big 5. You can get the ones like I have that are retractable ones, so they're easier to kind of throw in your car or throw in your overnight bag or whatever if you want to use them. And those are going to run you, for decent ones, they're going to run you around 50 to 80 bucks, right? Or you can get really nice, heavy-duty, thick-bore aluminum ones that will really hold up. So if now all of a sudden you want to start going, hey, maybe we'll do some off-road stuff, go hike Horsetail Falls or something like that, which probably won't exist this year. But now you can have something that will hold up to that kind of robustness. So, but Nordic poling is really a cool thing. And so we were looking at this summer doing a kind of a group. You know, we just get together and bust it out on Saturdays or something. So look for that. I'm going to teach a class on that coming up, just on that. Kettlebells is another interesting way to do it. You can get these things like the Rachel Ray ones or whatever they call them, you know. The real, what's that fitness gal? You know, yeah, Jillian, right? Jillian's got her own lines of kettlebells. You get them over at Big Five. You don't need the big bruiser. If you look up kettlebell exercises, they're looking like 40-pounders and all this stuff. Yeah, you're going to die doing that. Okay? You know, you just get like the 10-pounders, 5-pounders. You get the little light ones. Just doing these activities works so many proprioceptors. So many things are involved. It's awesome. So kettlebell exercises, another great way. Just add it into your mix. Okay? Things like Tai Chi and yoga, fantastic. You know why these people don't age? I mean, it's not like they're always eating the best. I mean, they're eating like radiated salmon right now, right? So, but why are they? Because they move a lot. They move a lot. They stay flexible. They do a wide variety of moves because it's every day. They're doing these things every day, and it's slow, fluid movements. Here we're like, can we get it done? We don't do yoga, we do hot yoga. You know? You know, it's like, this meditation's awesome. Do you have a speed book for it? You know, I mean, it's like, so you want slow, fluid movements. Why? Because what it does is it brings consciousness to the movement. You're aware of every aspect of that movement. You become aware of where your weight is centered as you're doing it. And all of that stuff wakes up. So no matter what condition you're in, you can do this. You can totally, they do this with people that are like jacked up from strokes. Anyone can do this. But you actually have to do it. All right.